Morning. Okay, good. Awesome. Well, thank you guys so much for coming this morning. My goal is that I can hopefully give you some really good information that'll be empowering to you in your life. I know experiencing arthritis already. So most people are told to stop moving with arthritis or limit movements, just restrict what you do. So my goal is to actually help people get back to full function so that restricting movement isn't the primary way that we treat the arthritis. So my name is Dr. Ace. I'm from Regenerate Health Medical Center. I'm a naturopathic medical doctor, and I treat pain orthopedically, systemically, sort of the whole body approach. So really my goals for this morning are to give a little bit of explanation about what is arthritis, because it's something that we talk about very colloquially, but most of us don't really know the specifics of what it is, how it's diagnosed, what characterizes the various types of arthritis. Also to know, how do I know if I have arthritis? Again, because it's so common, joint pain stiffness is just kind of equated with, oh, it's arthritis. So really, what is arthritis? What can I do to heal it? Again, not commonly talked about. We more are talking about masking symptoms, stopping movement. And lastly, really, how can I get out of pain? So this morning, we're going to go through the awesome journey of figuring out all this. And at the end, I'll have some next steps for you. So first, what is arthritis? So when you say arthritis, what does arthritis mean to you?
I was told it was little bone spurs.
Bone spurs?
Yeah.
Absolutely. When you think arthritis, what do you think?
Inflammation.
Inflammation, Andrew?
Degeneration in like a joint.
Sure. Okay, so awesome. All components of arthritis, but components of really one type of arthritis, the most common, which is osteoarthritis. So there's really 4 main categories, but over 100 types of arthritis. So the biggest one, osteoarthritis, aka degenerative arthritis. So yes, presence of bone spurs, joint degeneration, inflammation. That's the main one that we're going to be addressing today. The second most common category is inflammatory arthritis. So rheumatoid arthritis is one of the most common ones, and that's due to a systemic disease that attacks your joints. So the joint degeneration is secondary to the systemic disease process. The third one is going to be infectious arthritis, which is probably the least talked about and the least common. Following infection, you can get arthritis in your joints. And lastly, metabolic arthritis. So probably heard of gout, maybe even have some buddies that enjoy beer, enjoy fried foods, those sorts of things. Those really stabbing pains in your heels, in your knee, that's metabolic arthritis, gout. So it's crystals that actually deposit in your joints. So arthritis is incredibly common. There's more than 50 million adults and 300,000 children that are affected. So yes, children, it's not only, morning Barbara, it's not only a disease of people 50s plus, it actually affects quite a lot of the population. So osteoarthritis, so we talked about bone spurs, inflammation, joint degeneration. That's really, like I said, what characterizes osteoarthritis. So it can be one or more joints causing pain that tends to worsen with age. So it does tend to affect people in sort of 50s plus more so. And really what happens is cartilage, which is the cushion between bones. We're most familiar with cartilage in our knees, but we have cartilage at every joint surface to help with the sliding and gliding. That wears away, bones rub, then we're getting swelling, stiffness, and decreased range of motion. So the most commonly affected joint that affects people's day-to-day lives are knees. So a lot of my patients start to go through sort of the progression of symptoms. Well, they'll get a little bit of swelling, they'll get some stiffness behind the knee, then the kneecap starts to get a little bit more rigid, then they stop moving because it gets achy, and it's kind of this process that snowballs. With arthritis, though, the symptoms can come and go. So something that can be really confusing is they can feel really good at sometimes and really awful at others. So it's not purely, the degeneration in the knee alone that's causing the pain. We see the joint damage visible on x-ray. So like what you were talking about, bone spurs, excess deposition of calcium, because the body's trying to give the joint some stability. Because again, the body's not doing anything randomly. This arthritic process is not the body, trying to beat you up, trying to get you in pain. It's trying to heal. It's trying to do the right thing, but it just needs a little bit of help. And with osteoarthritis, over time your joints do lose strength and the pain really becomes chronic, to the point where a lot of my patients with arthritis, their primary exercise has become walking, and then a lot of them become too achy to walk. Then they go to recumbent biking because it's a little bit less impact, but then even that with the significant flexion extension of the knee can be a little bit irritating, so you're just kind of decreasing your motion until there's not really a lot left you can do without pain. So this is really not normal aging by any means. So a lot of people just think, oh, I'm old, I have arthritis, it's normal, no big problem, but really not normal, although it is common. So why do I have arthritis? So this is probably my favorite slide out of all of them, because it really dispels the myth that cartilage loss is inevitable and there's nothing we can do about it. So think of cartilage. It's made up of chondrocytes, so the cells of your cartilage, 70 to 80% fluid. So when we're told, hey, we need to stay hydrated, half body weight in ounces, really it is crucial for so much of our health, but our joints in particular. The solid part, collagen and proteoglycans. So that's what makes up our cartilage. Now, the process of building cartilage versus destroying cartilage is an ongoing fluid process. Just think of like your bones. At every moment in time, our bones are getting built up and also broken down. Just it's this fluid sort of life cycle. Same with cartilage. We have enzymes that when overexpressed can cause more breakdown of cartilage. But we also have inflammatory cells, interleukin-1, TNF-alpha. So it's this process of inflammation that causes an overexpression of enzymes that degrade your cartilage. And they also suppress the synthesis. So you have sort of a double whammy on losing cartilage. Your body attempts to heal it, but the degenerative processes keep overwhelming your body's ability to repair the cartilage. And so this is, again, distinct from age-related cartilage loss, because in osteoarthritis, you have more collagen loss. Joints tend to be less hydrated, and the constituents responsible for the joint fluidity are really degradative enzymes. So think of it again, kind of like our nails. We cut our nails, they grow back all the time. It's a natural process that our body regrows itself, but for some reason, because it's more challenging for the body to repair cartilage, we sort of have this common belief that cartilage cannot repair. Once I'm bone on bone arthritis, that's it, joint replacement, end of the road. So sort of paradigm shift that's not necessarily the case, and there are a lot of things that we can do about the cartilage loss and the degeneration. Risk factors. So being overweight, again, because that's going to cause more grinding on your joints, particularly for knees, not as much for thumbs, which is another common place. Age is a risk factor, but it is not inevitable as you age. Previous injury. So this is probably, the next two are the most significant ones, because a previous injury that has not properly healed, think of it as like a weak point that inflammation-driven arthritis can exploit. So a lot of people, the progression of knee osteoarthritis, which I always talk about because it's the most common, they may have had a minor meniscal tear. Or, maybe they played soccer in high school and they got a little bit of an injury that, stretched one of their ligaments or something. Maybe not major, but over time, when it didn't heal fully, when inflammation started to set in their body, when again those enzymes to break down cartilage got upregulated, it sort of exploits that weakness in the joint, and the injury turns into arthritis. The last is really high levels of inflammation in our bodies. So although osteoarthritis is not considered one of the inflammatory types like rheumatoid arthritis, it is still inflammatory driven. And there's a lot of nutritional lifestyle things that will exacerbate it. So we're going to get to that to talk about what you can do. But really the big thing is that cartilage can repair itself. So huge, yes, exclamation point. Local growth factor production is your strongest. It stimulates the synthesis of cartilage and down-regulates inflammation. So if you like specific terms and getting sciencey, yes, it is local growth factor production, factor beta, that is the most potent one. So really, when we give our body the right conditions to upregulate the growth of cartilage, we can do that and suppress the inflammation that breaks it down. So again, it's sort of that process. Are we building it up or are we breaking it down?
Are you going to talk about ways to influence that?
Yes, I am. Absolutely. So first I'm going to get to conventionally what most people are told to do about arthritis. So stop exercising is going to be the foundation, because osteoarthritis is worse with repetitive motion. So again, knees, if you're doing a lot of weight bearing, a lot of flexing and extending, you're going up and down stairs all the day, not going to be good. You're going to get more swollen, more achy, so it's going to feel bad. So you're going to be told stop moving. But rarely are people actually given the specifics in terms of strength and conditioning to keep moving in a way that's going to be very helpful at down-regulating inflammation, increasing stability. So a lot of single leg movements, isolating your muscles, your quads, your hamstrings to strengthen and build, but not in a way that's going to be high rep, repetitive, and cause that swelling and discomfort. Anti-inflammatory medications can be very helpful with short term, but have a lot of issues associated with them. Pain medications like opioids, now which are legal, have a lot of issues with addiction. So again, masking the pain. Topical pain creams are probably the most benign out of any of these options, because topical is much less potent. There's not really many side effects unless it's a steroid based, but there's a lot of essential oil things, icy hot, those sort of things. They can help, but they're really short-term management. To contrast that, one of the worst things you could possibly do for an osteoarthritic joint would be a cortisone injection. Who's heard of cortisone injections? Pretty commonly, given as an option. The problem is that cortisone as a steroid actually weakens your ligaments over time. So in arthritis, we're not really thinking of it as an instability condition, but there is that component of instability because the body deposits bone spurs for a reason, to try and stabilize the joint. But we think because it's stiff and achy that it's not unstable, but it actually is. And cortisone, which destroys ligaments over time, in the long term is going to make that worse. So for example, I just had a patient with a knee issue. She was given a cortisone injection, and then the week following, she was going upstairs, spontaneously heard a pop, and now she's not walking. So it's not always that immediate, but it is something that can help in the short term, but really not in the long term. Synthetic cartilage injections. Synvisc is a brand. They really can be helpful because they just add an extra layer of cushion, but it's a very short-term fix. So it's going to stop being helpful once the cushion goes down. The pro is that those do tend to be covered by insurance. So if you need some short-term relief that's not going to be suppressive or have any of the issues of the pain medications, that can be a really good option. The last is surgery, which is kind of a nuclear option, but it is unfortunately what most people who have bone-on-bone osteoarthritis are told they're going to need or will eventually need. So it's often a sort of waiting game until the degeneration gets to a point where you are a candidate for surgery. As opposed to what we're going to get to momentarily is that there really are better options that you can start doing today to at least decrease the progression of osteoarthritis and hopefully avoid getting any sort of surgery, because there's no coming back from that one. So the first thing, the biggest, most important thing, is to decrease systemic inflammation. So balancing blood sugars is one of the most foundational things to do, because when your blood sugars get high and then crash and high and crash, it is very inflammatory for your body. So getting rid of foods that can trigger inflammation like sugar, gluten, dairy, and caffeine, or limiting those, again, foundational. Adequate nutrients for your body. We don't really think about nutrients as something that directly affects inflammation, but inflammation is going to increase when your body is not getting what it needs, when your body is not able to mount a proper immune response, when your biochemistry gets sort of blocked up then we have markers that increase inflammation in our body. Homocysteine is something that is really inflammatory that leads to cardiovascular disease, but can also be nonspecific for inflammation. So making sure we get nutrients to support your body's function and really continuing to move. I can't stress that one enough, because once we stop moving, we stop getting a lot of blood flow. Our lymphatic system gets stagnant. Our lymphatic system is how we detoxify our body, and it's only pumped via skeletal muscle contraction. We lose bone mass, we lose ligament integrity, we lose muscle strength, so it's just sort of this downward spiral. So moving and strengthening your body, even with the arthritis, is absolutely crucial. And then really kickstarting your body's ability to heal your joints. So this is an area that has recently become much more available to the public, and there's been a lot more publicity about it from athletic people. So Kobe Bryant, different professional athletes. Who's the golfer? Tiger Woods, there we go. Yes, so a lot of these professional athletes are doing these regenerative type things to help heal their joints so that they can keep going with their sport, because that's their livelihood. But for people for whom, you're not getting paid millions of dollars to be on the golf tee, still can be really helpful at regaining the health of your joints, decreasing pain so you can get back to function. So regenerative injections, how they work is they get into the joint, cause very localized micro trauma and inflammation to kickstart your body's ability to heal it. So think if you were to sprain your ankle for the first time. You have an inflammatory response. It gets swollen, it gets achy, you don't really want to move it all that much, it's pretty tender. That's a good thing, because that's acute inflammation. That inflammation is bringing in healing cells, bringing in blood so that your body can heal itself. In our society, we've been taught to think that we have to suppress all inflammation, but really that acute inflammation is golden, lasting 3 to 5 days. So what we're able to do with this is start that short-term acute inflammation over again, so your body has a chance to heal the joint as if it were a brand new injury. Because a lot of things about our biology are not designed for us to optimally thrive. So once we have something that becomes chronic, like osteoarthritis, our brain doesn't really allocate a lot of resources towards healing it anymore. So osteoarthritis tends to snowball and keep getting worse. Now, acute injuries, so even if you have osteoarthritis in one knee, say you get, some sort of trauma to the other knee, your body's going to work on healing that. But it's not really going to work on the osteoarthritic chronic degenerative disease. So we manipulate the body to say, hey, this is a brand new injury, although it is still the same chronic one, get into the joint, kickstart that process of cartilage repair, and we can kickstart that several times until we have complete resolution of pain, stability, and function are regained. So for myself, I first did this in 2007, because I actually had significant degeneration in my spine following an auto accident, and it helped significantly. So I've pretty much been on a mission since then to become an expert in that and raise awareness so that people can avoid things like surgery, which I see a lot of longer term consequences from, whereas regenerative injections, very minimal downside, minimal downtime, and really you can have the potential to completely decrease pain. Now, helpful support along with this process when we're talking about decreasing inflammation, increasing your nutrients, there are vitamins that are really essential. So we can get them intravenously, we can get them orally, boosting vitamin C, because that's crucial for collagen synthesis. If you don't have vitamin C, your body can't make collagen no matter what you're doing. Now, vitamin B3, vitamin D, zinc, copper, manganese, these are all repair. So again, how our body can function is dependent upon our nutrient status. So I often recommend that my patients take collagen powder, glucosamine, MSM, and hyaluronic acid are all components of rebuilding joints.
So if you're taking collagen powder,
yep,
and you're not getting vitamin C,
yep,
so is the collagen still going to help?
Collagen, when you're taking the powder, can help, but I don't see it be enough to resolve. So these are all things where I call them helpful support. They are adjunctive things that are going to be helpful in the process, but in and of themselves, not strong enough to completely heal osteoarthritis. But really, I mean, vitamin C as a precursor to collagen, this helps your body make its own versus eating collagen.
If you did both, then that's going to help you.
Going to help you, yeah. In my opinion, if something has been proven to help, we might as well hit it from all avenues, as long as there are not really any downsides or side effects. And with taking nutrients, really not a lot of side effects that we're dealing with, especially when we're talking about omega-3s, natural anti-inflammatories and very lubricating. Systemic enzymes, bromelain, and other natural anti-inflammatory nutrients can also be incredibly helpful at breaking that inflammation cycle. Of course, we have to figure out the triggers for inflammation. Can be, again, poor nutrients, not enough movement, excess stress. But these are natural aids that, unlike your non-steroidal anti-inflammatory drugs, your opioids, all those types of things, are not going to have the downsides. Being natural, they're also not going to be quite as strong. So again, I wouldn't have patients say, okay, just take systemic enzymes for your pain and you're going to be good. This is, they work synergistically to help support decreasing inflammation and rebuilding the joints. Dietary-wise, we can also eat foods rich in omega-3 fatty acids. We can eat plenty of fruits and vegetables high in vitamin C. We can drink anti-inflammatory teas like ginger and turmeric, or use those as spices in our cooking. We can avoid refined and processed foods, especially hydrogenated oils and sugar. If there were one thing I'd have to say that really makes osteoarthritis worse, it's going to be sugar. And a lot of people are actually addicted to sugar and don't really realize how much they're getting in their diet. So with a lot of my patients with osteoarthritis, we're doing sugar detoxes and avoiding sugar, usually for a period of 2 or so months while we're undergoing the process of repairing their joints. My hope is that it sort of kickstarts an awareness where they feel a change in their bodies, because once you have decreased your sugar intake, your natural taste buds to sweet fruits and vegetables really increase to the point where if you go back to what you were having before, it tastes so incredibly sweet that you're like, how could I have enjoyed this prior? So really decreasing sugar is key to resolving arthritis. And with that, I'd also say alcohol. Alcohol is definitely something that rapidly converts to sugar. So I have a lot of patients also, when we're talking about their arthritis, talking about nutrition, lifestyle, what the foundation is. If they really want full resolution of the arthritis as quickly as possible, no sugar, no alcohol, those types of things to help the healing process. Now, the more committed you are, the more you want your body to heal, the more you can avoid those things. For me, I never tell people 100% you have to do this, because I want it to come from the patient wanting the best for themselves. And if I tell somebody you have to do this, I don't see really good compliance unless it comes from them creating the foundations for their health and decreasing the arthritis. Okay, lifestyle-wise, so we talked a bit about exercise. So regular exercise to increase muscle strength is key. You get stiff, and there's this illusion of stability. So a lot of my patients are saying, you know what, I'm stretching 3 times a day and it feels really good when I stretch, but I have to keep doing it. So in stretching, they're actually furthering the instability situation. So the key is to actually strengthen your joints so that you're not having as much of an issue with instability. So incorporate weight reduction programs to lose weight. Use hot-cold therapies. Again, a very simple intervention you can do, but it pumps blood flow. And healing happens the more blood flow we get. So many people go straight to the ice pack. Ice decreases pain, but it's not going to help healing. So it's going to paralyze your nerves, and it's going to stop your lymphatic drainage, all the toxins of the damage, constricts the vessels, exactly. So I'm a fan of ice as long as you're doing it with heat and pumping your circulation. So you can do sauna cold shower. That's a really good way to do things. You can do hot cold packs. You can do cryo saunas. That's a really good one where you get really, really cold and then a rush of blood flow. Anything that really increases blood flow is going to help. Okay, so pretty much summary here, what can I do? Keep your body moving, build muscle mass, stabilize your joints, improve your hormones, support your body's ability to repair cartilage. So using herbs and nutrients, colorful fruits and vegetables, plenty of fats and collagen. Get evaluated and treated to have a plan that improves your health. So I can't tell you how many people come to me saying, you know what, I'm doing so many things that are improving my health, but I don't really stick to anything because I don't have a plan. Because there's nobody that is working with them to check in on, hey, that fish oil that you're taking, is that actually helping you, or are you doing it just because it's a good thing to do? So I don't know about you guys, but when I don't know if something is going to be effective, I'm not really fully committed to it. So I kind of half-ass things, and I don't really give myself the best opportunity to succeed because I'm not accountable to anybody. So in that process, a lot of times people undermine the efficacy of things that could help because they're not consistent. And the last thing is really regenerating joints, getting into the joint to kickstart that ability to heal the joint so that we essentially reverse the osteoarthritic process. And there's really 3 different levels of potency that we can use for that joint regeneration. Has anybody heard about prolotherapy? So it's the base level. We use an inflammatory sugar solution, which is ironic because I'm having people avoid sugar. But again, we're upregulating that short-term acute inflammation. So sugar is helpful with inflammation. We use that in the joints. That one's great. The more advanced the arthritis is, the more I go to things like platelet-rich plasma, where it's a process where we essentially harvest growth factors from your own blood and inject those in there to boost the healing. So completely natural and specific to your body, but it's just that much more potent. And then stem cells. Who knows what a stem cell is? Dave, you don't count. So stem cells are the raw cells that can become any tissue in our body. Those are the most potent because if we inject those locally, they can become cartilage, bone, muscle, ligament, whatever we need. So they're basically the most potent way of healing the joint from the inside.
Cells come from, you get it from the
You
blood
can't,
too?
nope, not from the blood. You harvest it from either fat or bone, mostly in the hip, or we get it from amniotic fluid. So amniotic fluid is a way to not have to harvest it from the patient themselves. So there's really 3 ways to get it. Platelet-rich plasma is 100% from the own patient's blood. And I've had it done in several places. It's pretty easy blood draw, and it's amazing what we can get from our own blood to help our tissues heal. So
you get amniotic fluid from somebody else, or
Yep, because
your wife has a
Yep.
child?
So there are labs that process it so that we don't have any issues with receiving it. So imagine, if you get an organ implant, right, you have to basically take medications to stop your immune system from rejecting it. In amniotic fluid, we don't have that problem because it's essentially not differentiated yet. So that's where we can source it from, labs that actually harvest from donors and process it for, cleanliness, which is not the best word, safety essentially. But then that way you don't have to undergo the fat harvesting or the bone marrow harvesting. So there's options there. So right now, I know that was a lot of information. So you're probably at one of 3 places. One, you enjoyed the information, have some takeaways in terms of what to do. Saw Andrew taking notes, which is awesome. So I hope that you guys all got something great from it. You also may be ready to start treatment. In which case, afterwards, go ahead and talk to Dave. He'll answer any questions that you have, and we'll get started. You also may have some more questions. Hey, we talked a lot about it, but you may be wondering in your specific case, how does this apply to you, given your circumstances? So I'd be more than happy to get you guys set up with a complimentary call where we can say, hey, these are the steps that I take with people that are dealing with osteoarthritis, or we can talk a little bit about what, your situation is to get you the next steps. Because my goal is to give you information so that you can essentially get empowered in your health and hopefully no longer be limited by the arthritis, because I know it's possible to heal it. I've seen it healed, and it really does change people's lives when we can avoid surgery, get people off pain medications, get them walking and back to full function. So thank you guys so much for your attention. And I'm more than happy to answer any questions right now.
When you say arthritis is not inevitable, so if you have a 90-year-old,
Yep.
can a 90-year-old not have arthritis?
Yes, they can have age-related degenerative changes which are not as advanced as arthritis. So you can have sort of dehydrated joints, you can have, you know, aches and pains, but not actually be the arthritic process. So, and that's where there's a lot of confusion. People tend to downplay the discomfort or of osteoarthritis, thinking that there's not a lot they can do about it because it's normal. But age-related degenerative changes are not the same as arthritis. Arthritis displays more cartilage loss, more grinding, more restriction, more swelling, more bone spur deposition, so it's not the same process. And it is not necessarily inevitable to have aches and pains just because you are 90 as well. If we have somebody who's moving well, hydrating well, good nutrition, you know, good exercise regimen, it is definitely possible. Think of people, you know, legends like Jack LaLanne. Into his 90s, you know, he was pumping iron, doing super well. So there's a few outliers in our culture but the vast majority, we think of this inevitable decline to disability. Any other questions? Cool. Well, do you have another one, Barbara?
Yeah.
Yeah.
Regarding the Prolo, so is that something, if once you start it,
Yep.
is it a forever thing?
No, it is not. So it's something, well, it depends. If we're talking about osteoarthritis, again, because with osteoarthritis, we have degeneration. So if you have inflammatory arthritis, rheumatoid arthritis, yes, prolotherapy would be something we would have to keep doing because the major issue is the systemic inflammatory issue. Most of the time an autoimmune process where the body targets joints and will cause degradation. In osteoarthritis, quite different. We can do a series of prolotherapy and that may be all that you need. Now, how many it takes will vary by each individual because the regenerative injections are a catalyst and then the body actually responds to those injections. So what we do and what we've developed is a program to aid the body in optimally responding to those injections. So we utilize a lot of what in terms of the nutrients, here, you know, nutrients, nutrition, hormones, you know, just a lot of lifestyle things to make sure that people respond well. We also do intravenous nutrients because that's the most potent way to support your body and make sure you get high doses of these nutrients. The zinc, the manganese, the vitamin C, all that. So we really make sure that people are supported. So the different levels of the regenerative injections have sort of different estimated times that you'll need to do. Prolotherapy, being on the less potent end, tends to be 4 to 6 injections. PRP tends to be 2 to 3. Stem cell tends to be about 1 because the level of potency goes up. But really in the injection process, and this probably more specifically answers your question, Barbara, we are stabilizing the joint and regaining function, healing the joint. So it's very different from a cortisone injection or a synthetic cartilage supplement, which are designed to mask pain for the time being. We're actually healing the joint and increasing function. So, you know, it is not necessarily that if you do prolotherapy, you will never have any discomfort in your life after that, but it is possible to fully heal the arthritis to get you back to full function. Does that answer your question?
Yeah.
Okay, awesome.
That's PRP?
Yeah, so PRP, platelet-rich plasma, is the one where we draw blood and concentrate the growth factors. Yeah.
I've heard of people getting cortisone injections and then never having pain again, even like a year, 2 years later. Somehow the cortisone worked for them.
So it all depends on what you're dealing with. If you have an acute inflammatory situation like a bursitis, so bursa is the sort of sac inside your joint surrounding it. If that is inflamed, a steroid injection can shut down that inflammation, which can stop any sort of degenerative or painful process. So that happens sometimes, but most of the time it is not going to be that incredibly inflammatory. So if it is just a major acute inflammation, steroids help end the cycle of inflammation and therefore pain. But if you've already had damage and degeneration, that will shut down the inflammation for a time, but it's going to keep progressing and the pain's going to come back. And that's where the majority of people are. So it's not that I hate all steroids, it's just that they are used in a way overgeneralized way as oftentimes a first step to say, hey, you have this pain, let's inject cortisone and see how you do. Which to me is a little bit unethical, given that there are significant downsides to it in terms of the joint health in the long term. So it's up to each individual to do the pro-con analysis. But again, unless it is a hot, inflamed, bursitis type situation, I would not recommend getting the cortisone, even as a first line.
I'm a massage therapist. I have a long-term client that when I first started working on him about 10 years ago, chronic hip pain. He was getting cortisone shots every 3 months.
That's unfortunate.
And the doctor said it wasn't damaging it because it was in the joint capsule. It wasn't in the surrounding tissues. And I was doing Thai massage on him and just doing trigger point stuff and just working the hip and basically moving it around. And those shots started to decrease. He was going from 3 months to 6 months. And then for the last probably 7 years, he hasn't had any.
Awesome. So that was probably multiple of factors. I'd say your work was probably helping him substantially in increasing the joint movement, increasing the stress through the joint. So it all depends on how advanced the osteoarthritis is, but that person's very lucky if they had, more than 3 cortisone injections and didn't have any sort of tendon or ligament issue. Very, very lucky, because again, what I've seen more and more are the people that have had a few and that have the spontaneous, tendon issue or the ligament instability after that. And then they start to get crunchy, even more osteoarthritic joints. So it's something that, yes, sometimes can be helpful, but there are significant risks with it. So I would use it very, very cautiously in a very subset of people. So versus as compared to the joint injections here, which have none of the risk of decreasing the ligament integrity.
When you had your injury, did you have all 3, or did you start at the time?
At the time, I started with prolotherapy, but since then have done a lot of my joints with both prolotherapy and platelet-rich plasma. I have never had stem cell personally. So, yeah, those are the 2 that I have had. But in the process of becoming a regenerative injection therapist, you have the wonderful and yet not so wonderful experience of you have to actually learn to inject on real bodies. So you become a pincushion. So I know pretty much what every joint feels like because I've had it done myself. I've also been the unfortunate beneficiary of a lot of injuries because I didn't know how to take care of my body from an early age, overtrained, multiple car accidents, multiple hormonal issues where I just sort of wrecked my body. So I've really learned how to strengthen it, how to keep it healthy, and how to take care of my joints and health from a place of really messing myself up early on. So,
and
yeah.
How about joint stress and wear and tear from muscle imbalance, which can be part of inflammation inducing?
Absolutely.
Versus just arthritis or just imbalanced movement patterns.
Sure. Well, and that's where I would say the strength and conditioning component is absolutely crucial. And I'm not saying, hey, just, do bicep curls or something. A strength and conditioning program that is going to help balance your body. We're not designed to be symmetrical. Our lungs are not symmetrical. Our organs are not symmetrical. So it's silly to me to think that everything should be perfectly symmetrical, but we should be very stress resilient and able to handle a wide variety of movements without having pain and discomfort. So I think that strength and conditioning becomes key in terms of helping balance the body. Manual therapy, physical therapy can also be very helpful with that. The movement strengthening component definitely does not get enough attention. And that's why I love partnering with gyms, you know, here like with Andrew at Innate Fitness, because they really get how to strengthen the body. And I think if we had more people doing the strengthening side, we would have a lot less pain and we'd have a lot less arthritis that would develop. So.
I have a question on
Yeah.
like, so if you're going through this process, you change your diet, you got your body naturally regenerating collagen. What about bone spurs? Do those
Sure.
go away on their own, or is that?
It depends how advanced they are.
Okay.
Because bone spurs are going to be deposited because of instability. Your body literally deposits that calcium to help. So if they are very advanced, if they are rubbing on tendon, if they are really irritating, we can't hope for them to completely go away. But as we increase the stability, we can decrease the progression, and we can use nutrients like vitamin K, we can use strengthening to help decrease the progression and slightly resorb them, so slightly decrease the size of them, if you will. But so if it's an incredibly advanced one, you know, for example, shoulders, sometimes if it's incredibly advanced, your only option is to have it surgically removed. It just really, really depends. But I would say surgical removal, they're on how, you know, how large and how they impinge the joint, really.
Right. And if everything else is functioning better, that might not be as big of a problem.
Yes, because this talk did not address this, but I'll just end on this. Pain is not purely orthopedic. Pain has a lot of components to it. It has inflammatory components, hormonal components, emotional components, physical components. So really with arthritis, most people are concerned about the pain. I do have some patients that are purely concerned about the degeneration of their joints that's been evidenced on imaging, but the pain is multifactorial. So a lot of people think, okay, I will, you know, heal my, you know, I'll have my, you know, meniscus cleaned up and my pain will go away. But the pain's still there after the meniscus looks totally fine. So pain in and of itself is another bird that I also take into account, but we have to heal the orthopedic with the systemic inflammatory to get the full resolution. So any other questions? More than happy to set up calls with you guys and answer those and hopefully get you guys some more information. So thanks again for coming.
Thank you.
All right.